Every day, millions of us check the weather to prepare for what's ahead. But increasingly, the forecast is changing, and it's now turning dangerous and deadly. Overwhelming heat waves, muggy and thick air. And then there's the storms that don't just pass by, they disrupt and endanger. We can't face this alone, and we don't have to. Across the world, solutions are rising. There are early warnings that reach people in time, community response plans that save lives, and leadership and funding directed to where they're needed most. We can adapt our health systems to a warming world. In Rio de Janeiro, a first-of-its-kind heat protocol combines health and weather data to forecast risks in advance, triggering alerts that give clinics, businesses and families time to act.
Então, observar os dados climáticos, mas integrar eles e olhar eles à luz dos dados de saúde foi fundamental para ter as evidências do protocolo de calor da cidade do Rio de Janeiro.
In rural Bangladesh, farmers, site managers and health workers are trained to spot heat stroke and use local forecasts delivered straight to their phones, so decisions in the fields protect both lives and livelihoods. In the southern United States, a model born in New Orleans is scaling to rural North Carolina, where trusted community leaders provide residents with cooling stations, food, water, and other life-saving supplies.
What started as maybe a very simple idea of solar panels and battery backups where you can charge your phone has turned into so much more.
And in Ghana, a small team of experts is helping countries most vulnerable to extreme weather build investment cases, ensuring proven solutions receive the funding they need to save lives. Let's take action by shaping policies that protect our health, our families, and our future. Because when we prepare and adapt, we thrive. Good morning. Welcome to our audience right here and delegates in Berlin, and also our viewers who are watching online. This is a plenary session convened by the Rockefeller Foundation. It is about heat and health in a warming world. My name is Femi Oke. I am your moderator for the next 90 minutes, and we will be talking about the impact of extreme heat on our bodies, on our communities, and on our global policies. So when the Rockefeller Foundation approached me and said, Femi, would you moderate this? It was an unseemly short period of time between them asking the question and me saying yes, because I am a former weather forecaster. I have forecast weather, I'm not going to say accurately, because this was in the 80s and the 90s, but I have forecast weather regionally in the West Midlands, in London, in the UK, and internationally for CNN. And over those many years, I have seen the climate change. I have seen the climate crisis become a major crisis. And as I showed people extreme weather, it was obvious to me that you can see mudslides, you can see flooding, you can see extreme cold, but what do you see on TV when we show you extreme heat? People in shorts, walking around eating ice cream or going, phew. But today we don't have that challenge. We are not going to show you about the impact of extreme heat on our health systems and why they need to adapt. We will tell you about it as well. We are going to start with the impact of extreme heat on our bodies. Dr. Leah Werner, good morning. Dr. Jason Lee, hello. Dr. Werner, what does it say on your business card?
I don't have a business card.
If you had one, let's go back 5 years, what would it say?
I'm a family medicine physician, and I'm an assistant professor of medicine at the School of Medicine in Portland, Oregon Health and Science University. I also direct the climate change and health program there as well.
Good to have you. Dr. Jason Lee, do you have a business card?
No.
on our imaginary business card we're just going to create for the next 5 seconds, what does it say on it?
Yeah, I'm based in Singapore. I direct the Heat Resilience and Performance Center. I also chair the Southeast Asia Heat Health Hub. So there where we do work beyond Singapore, predominantly for Southeast Asia. So by training, I'm an exercise and thermal physiologist.
So good to have your expertise here. All right, Dr. Werner, first of all, let's start with extreme heat. What does it do to our bodies? What could you then go to the doctor, like your primary care physician, and say, I have a problem with? What would you say?
So it's really important when the extreme heat is happening, because humans can acclimate. Usually takes about 2 to 3 weeks. And I'm going to let you get into more of that since you're the physiologist. I'll do some basic understanding. We increase our blood volume. We have protective mechanisms to maintain our sodium and potassium levels. Our heart adapts and responds, our kidneys adapt and respond so that we can maintain a core body temperature through sweating and offloading that heat. When you have not had the ability to adapt to heat, let's say there's a heat dome that happens in the spring, your body, especially if you have chronic medical conditions, cannot offload the heat, and your core body temperature dangerously rises, and it puts an extreme amount of stress on your internal organs, particularly your heart and your kidneys. And so for people who are vulnerable, small children who have a difficult time with thermoregulation, pregnant people, people with chronic medical conditions, this can be deadly.
Dr. Lee, if you build on this can be deadly, what is the biology that makes that extreme heat reaction something that potentially can kill us and does kill us?
Yeah, first, if I may, I just want to say that it's actually very difficult to die of heat. I said that yesterday, I'll repeat it again. When someone died of heat, it means the system has failed. Many who didn't die were compromised. Yeah, so heat is not potentially preventable. Heat death is 100% avoidable. So there lies our aspirations of why we need to do this work more correctly and not just simplify the approach in hope to save every life. The good news is, physiologically, we can deal with heat, most cases. We have the behavior response, so if you can, usually most of us, I think sitting in this room, the audience, I don't think you will die of extreme heat. You could be compromised by other means, but let's put in context the most vulnerable populations. One of the most powerful ways is to rest when you get too hot. But can they rest when it's too hot? That's something we got to ask ourselves. Resting is most powerful. Work rest cycle is a form of strategy where you rest so that you can work safely and efficiently. Water breaks is another example. But I just want to use this chance to say that it's the break that is doing the magic. Yeah? We often call it water break and say water is the one that solved the problem. Let's give them loads of water. Trust me, next time if you take the same amount of fluid without taking the break, you will immediately acknowledge it was the break that does all the magic. What happens when you're hot? The skin blood flow will increase because you need to push the heat that is stored in your body to the environment. But note, the same limited blood has to supply to your vital organs, to the muscles, to your skin. So now there is competition for limited blood volume. So if you are weak physiologically, this heat assault will perturb you at some point. You can also sweat, but remember, it's the evaporation that does the trick. Either sweating per se does not lose heat. Sweat evaporation does. Many of the context that we are talking about is not just warm, it's also humid. But there lies an opportunity. Today, with all the advancement in science, including material science, I see the day potentially we can propel the humidity around us. Every sweat will be secreted.
So rest, sweating, these are immediate strategies straight away to cope with extreme heat. Dr. Werner, I saw you reaching for your microphone. Articulate that reach.
So because I do community medicine, and I agree with you. But we have a problem in our urban cities in the United States, urban heat islands. People live without tree canopy, and they live in building materials that retain heat, making their homes dangerous during heat waves. And with wet bulb temperature and humidity, oftentimes with rest, people cannot sweat because the water in the air is matching their ability to sweat. They can't offload the heat, they can't cool. And if they're in an urban heat island and it's humid and it's hot, it creates these neighborhoods that are killing people, essentially. So in our heat dome in Portland in 2021, the Pacific Northwest is not used to the level of heat that happened. And we have one of the greatest disparities in urban heat islands. It can be, I'm going to speak in Fahrenheit, 13-degree Fahrenheit difference between an urban heat island and a neighborhood that has tree canopy. So when we went up to 116 degrees in the spring, and again, nobody had time to acclimate, the urban heat islands were at 130 degrees, and this is where families live. And they live in brick concrete buildings without shade, and their homes inside were even hotter. And I think for me, nobody talks about what it's like to be a primary care physician taking care of patients for 10 years. We give so much love to our patients, and so when we lose our patients, there's no preparation for what that does to us as a healthcare workforce. And so even though we had primed our patients, please don't go outside. Please access air conditioning if possible. One of my patients went out to get his mail and died of cardiac arrest in his driveway during that weekend. And even with rest, just the mere act of walking to his mailbox, his heart couldn't withstand the heat. And so there's a social justice component to this as well. The right to rest. A lot of outdoor workers don't have worker protection to be able to rest. What do we do with these building structures? How can civil engineers make safer cities? How do we extend tree canopy to everybody? How do we protect people from the dangers of the heat? Yeah.
Dr. Werner, these are excellent questions. Do you have excellent answers to your excellent questions?
I do, but I don't have a functional government right now that can address these things. So what it comes down to is...
You went there very quickly, Dr. Werner.
Well, it comes down to our local communities, and that the responsibility is on all of us. And so no one's coming to save us. There are no heroes. This is everybody. And part of my joy in this terrifying work, I showed up for the work, I stay because of the people. I meet the most incredible people that no matter what's going on in the external governments of the world, they keep moving forward and they keep doing everything to protect their communities. And so I work within my community. I work with my community health workers, my traditional health workers, our nurses, our care managers, our community leaders, so that we can make an impact locally, and that's my answer for today.
Yeah. We are using some meteorological terms. Does everybody know what an urban heat island effect is? Yes? Yes. It's basically where a city creates more heat than the surrounding area because we're all together and our activity and the work that we're doing is creating that extra heat. You also did wet bulb temperature as well.
That's when the humidity in the air is so great that even if you're sweating, the sweat doesn't cool you down.
Yeah.
Maybe you can speak more about that, but yeah. And so the urban heat island effect is also, it's the building materials. It absorbs heat and it radiates heat at the same time. So the inside of the building is hot and it heats up the core city temperature, that neighborhood temperature.
Dr. Lee, tell us about some of the research that you're doing into basically thermal physiology and how that's going to help us. Because I loved how you started. Almost the first thing you said is, it's really hard to die from extreme heat. That is such a great place to start. But then tell us more about the research.
Yeah, first, humans have actually operated in hot environments. So as we plan prospectively what is to come, look back. May it be the mining industry, military during World War, there are documents being produced. Sports, major events are often held in summer. And today, we even know that heat, if you use it correctly, can, at times, for most of us, can be a eustress and not always a distress. So there are answers in history that we can glean, and with cooperation, we should take it forward. So may it be a suite of conditioning, heat acclimatization, work rest cycle, pre-cooling, per-cooling, post-cooling, the correct way to drink with AI, wearables, IoT. I think the solutions are and enablers are all there. But right now, do we have the gumption? Do the stakeholders think that this is costing the society? That is a more difficult question to address. We don't have to reinvent the wheel. We need to convince. Citing that example, many think if you rest, means productivity will decrease. In many places, you get a fixed salary. What it means that when it's hot, you will slow down. There's no motivation for you to work hard if you are being paid a fixed salary. On the other hand, in some contexts, you are being paid by piece. So today, right, even we have the most effective climate-based heat health warning system. I like you to imagine with me, now you are the platform worker delivering Uber food. I say the weather is going to get very hot. You should slow down because you may get heat injured. Pause for a moment. I think you'll look at the advisory and say, thank you very much. If I don't work equally hard, by 6 p.m., my family will be compromised. I will push as hard. But there lies, if you know that is the behavior of the individual, maybe we always talk about whole of society, whole of government approach. Let me give you a concrete example how we can hack this. Yeah. Maybe we should not just push out policy. Government can only push out policy. Often they cannot resource people to respond to the policy. Speak to the platform CEO. Say, do you know if you don't regulate this and incentivize, you are paying out in other ways because the epidemiological data are clear. Yeah, there will be more accidents, there will be reputational damage. It's costing you much more. Speak to the insurance company. Today, there are conversations of parametric insurance. Means once we achieve a certain threshold, I pay out. Now you are telling the driver or the delivery man or woman, say that I'm going to pay you that extra order. Your 6 p.m. quantum will remain the same. And for the rest of us, do we operate out of empathy? Or do we complain, say, why is my order late again? Someone is taking the risk on our behalf. Maybe in the application, besides the normal tip, there could be a climate tip. So if everyone contributes and pay the premium, I think there are higher chances that people will respond. And finally, I ask that as we go about undertaking this work, always see it from the recipient's perspective. Humans have this weird behavior. If I'm not part of the development, even you have the best solutions, sometimes I don't buy it. If I own it, you consulted me, we co-develop, I have a stake in it, and I will use the tool eventually. So we should also harness behavior and implementation sciences. My point is, to do this well, we cannot repeat the old ways of doing things. If you don't secure livelihood, forget about investments on health. Many of the vulnerable populations are after livelihood. Secure that first, then give you the chance to talk about the next step. Thank you.
Dr. Werner, you touched on this in terms of vulnerable communities, vulnerable people, with your little chat about social justice. Can you take us a little bit deeper into who is most vulnerable when we're looking at our cities warming up, our regions warming up?
Yeah, so people with chronic medical conditions, people who are living in poor neighborhoods that are often in buildings that are poorly constructed, pregnant people, children, people with disabilities or differently abled that cannot quickly access behavioral modifications to cool themselves, or people without social capital, meaning people who don't have family relations or friends that are taking care of them and mentally ill. But there is so much that is rapidly shifting in the area that I live. My state, Oregon, has an incredibly high homeless population. Homelessness is a huge risk factor. I like to call these frontline communities. People have learned how to live in extreme weather events. In some ways, they have written the manual on their own survival. What doesn't work is the top-down approach when the ivory tower, the academics come down and say, this is how this should go, or the politicians say, this is how this should go. When you talk to people, you actually realize they often know what they're doing, and they're doing it with very little. And so how can we work together in a collaboration to help them to survive? One issue that was terrible during the pandemic is Portland's houseless population exponentially exploded. And businesses downtown were very upset, and so they created this no camping ban policy. You can't camp for more than 24 hours. So what that essentially did was clear out homeless populations from the cities. And where did they go? They moved into the Deschutes National Forest, which is wildfire country in Central Oregon. And I don't think that Oregon has ever seen huge houseless encampments in national forests and parks before. And so the medical community in Central Oregon was overwhelmed. How do we take care of the houseless population, hundreds and hundreds of people that live here, but also how do we prevent them from accidentally starting wildfires? Wildfires decimate vast tracts of land. They're worse during heat. And so I worked with Mosaic Community Health on training what we would typically call street medicine teams into forest medicine teams with traditional healthcare workers to do houseless checks in the forest and replace gas-powered propane stoves with electric stoves to mitigate fire risk. And I will say, we did not have any crazy fires started in these encampments. And so we respond quickly to policy that happens in urban centers that creates these offloaded impacts that really negatively impact other communities, and we have to think about climate change. And so I don't have a climate change conversation in Central Oregon because a lot of people don't believe in climate change, and so I modify my language. I use my language as a clinical tool and say, we have wildfire season happening. How can we protect each other from the wildfires? I meet people where they're at. I use the language that they use. And my goal is not to change their minds about climate change. My goal is to draw them in and protect them. And I'm going to meet people where they're at, and I'm going to listen very closely to what do they perceive as happening, and how do the things that they do already work? How can I catalyze what works, and how can I remove the barriers that's stopping them from being safe? Does that make sense?
It makes perfect sense. You're basically linking your work as a primary care physician into the environmental impacts that we're already seeing. Is what you're doing revolutionary? Are other primary care physicians doing the same thing?
I meet people everywhere that are doing the same thing. This is a collective consciousness. I might think I'm thinking of this on my own until I meet other people that are doing the same thing, and I think as humans, we're all interconnected, and maybe I heard it somewhere and I don't remember where I heard it from, and I thought it was my own original idea. I don't take credit for it, but I come for the work, I stay for the people. The other people that are doing this work are so meaningful, they matter so much, and they're so inspiring that it keeps me going and keeps me looking for solutions on how I can impact my community in a positive way. I don't want climate change to be some weird niche idea in medicine. It's a determinant of health. I want it just incorporated within the system and with our outlook on human health.
Let me just see, any thoughts? Anybody want to say anything to Dr. Lee or Dr. Werner? Have they inspired any thoughts before I move on? I don't want to leave anybody behind. Yes. Hello.
Yeah, we're talking about populations here. I am Kins from the Pasi Foundation in Pakistan. We work in a lot of key vulnerable populations. Like you were saying, if somebody's salary is dependent on the yield, we work with coal miners, we work with brickland workers, we work with islanders, whose, for coal miners, the yield is the whatever quantity of coal they're able to bring out. And then they're working in scenarios, if you can imagine a brickland, which is all layered by heat, they cannot work in the cold season because brickland smoke creates smog. And they are bound to work in the heat season. So let's say, for example, we used to do only health. Now we believe that health without addressing some kind of climate adaptation mechanism is not possible. Can you speak about some kind of innovations that you have seen that can enable the adaptation for these populations? Because obviously their income, they don't have the leverage to say, okay, we'll work in another season or in another hour or something like that. Thank you.
Dr. Lee.
Yeah, a short response is I said there are solutions there. You don't need to innovate for the sake of innovation. Yeah, there's always space for that. But resting, shading, hydration, there are simple things that we can scale. But today, as I say, I'm not sure many other employers truly appreciate this investment. They almost think, oh, is this an altruistic exercise? You're asking me to profit less, to bless my workers more? No, I'm saying that it's not a zero-sum game. Data that show if you rest them in the right time enough, they become more productive. And this is where the whole of governments come into play. You don't just see it during the work hours, the investment you make in protecting your people, your workers. At some point, they will retire. The last thing you want is to give these people who are damaged during the working years, and now your Ministry of Health and say, I'm doing the damage control and exercise. So the more you see it across a whole society, the same $1 investment will go much further. Yeah, so see it as a system.
Thank you. Andrew Mackenzie from the Physiological Society. We've done a lot of work with Jason, who does great work in this area. I wanted to say one thing about mitigation, because I don't think we should lose sight in any climate conversation about the need to tackle climate change itself. And if you look at a lot of the projections, there will be some physiological limits that we will cross if we continue going where we're going. And that's something that will affect everyone. There's vulnerable groups, obviously, are most impacted today. But everyone will be affected if we don't tackle the root of the problem. And we know the physiological limits mean that even for healthy people, there will become a point when it just becomes impossible to survive. And I think any conversation about climate change has to keep that side of the argument front and center as well.
Good morning.
Good morning. Thank you for sharing your experience. My name is Gaspard. I'm from France, and I'm quite interested in the homeless community within my neighborhood. And we do have this problem of heat wave that are killing every year some of them. And one thing that we are trying is basically advocacy, because as you described in your example, the fact that they went for the forest is not a deliberate choice. It's come from the choice of the policymaker, and one of these consequences was that. When we are doing some advocacy, every time we try to find some incentive to the policymakers. Do you have, from your experience, some idea about what incentive to the town hall person, the politician, can we give for them to take those populations that are super niche and super excluded into consideration when thinking about how to create a city? Thank you.
It's a very excellent question, and I think it's one that Oregon has been grappling with, especially Portland, where I live. So the antagonism between the policy and then the healthcare system. And we have a federal program in the United States called Medicaid, but Medicaid is managed state by state, territory by territory. So what Oregon has done with Medicaid is it has taken climate change and houseless issues as a social determinant of health, and it has embedded it within its Medicaid system. So we call it our health-related social needs benefits. It's a climate benefit, housing, nutrition, transportation. And we employ street medicine teams. So prior to the camping ban, people would stay in one area for up to 10 days. And it would allow the street medicine teams to find them, to be able to bring them their heart medications, their blood pressure medications, food, check on them, check on their well-being, take vital signs, and then ensure that their tents were appropriately outfitted and safe. And we had portable air conditioning units that were solar powered and with battery packs, and so people could cool off inside their tents. And so we did not have a lot of money to do this, but we created a medical criteria and then a social criteria for these benefits. And so we were able to track people. After this policy of no camping bans, we have had thousands of people die. And part of that is the street medicine teams can't find them. We can't give them their medications. They clean out their tents, and so they lose access to their supplies and their medications. And we have no way to find them, and then they can't cool down during heat waves. So there has to be this risk-benefit between, are we comfortable with houseless people living all over our cities? Some neighborhoods are, some neighborhoods are not. And then how can the healthcare system find these people to keep them safe? And so we're exploring outdoor living parks for people with pods or very tiny homes. Often we find that even if you offer housing to people who are living on the street, they don't want it. They're distrustful of institutions and of other people, and they want to be alone, and they know how to survive if we allow them the tools that they need to be on their own. So what we're doing now is we've got plots of land with tiny little pods that people can choose to be in, and the street medicine teams can find them as a way to try to bring them back out of the forest into urban areas where there are more resources. So at least we're trying something. You know, as Voltaire said, great is the enemy of good. You try, implementation science, what works, what doesn't work, and it's an iterative process, and then one solution for today may not be the solution for tomorrow because the ecology changes, data changes, we have to be flexible and adaptable. And I love human-centered design. We are always thinking, how are we making this more human-centric and human-friendly while living within our ecology? So we can't say, oh, problem solved, we're done. It's always looking at what's happening and how do we need to tweak things and do it differently and be flexible with that. And I think doctors really like to feel like we're smart. And we have to abandon that and allow for a collaborative leadership and learning. I learn just as much from my patients as they do from me. And then within that, that has allowed me a joy in medicine that I never thought would be possible and has kept me from burning out, especially after being a frontline COVID doctor. And so that's my answer. It's long-winded, but it's iterative policy and practice.
Dr. Lee, Dr. Werner, turn around slightly and very carefully. All right. Because you're so smart, this is going to be a very brief response to a very brief question.
Hello, my name is Carolyn. I am a medical doctor from Dresden, which is a very dry area. And I'm also an advocate for more climate protection. And I just want to introduce a project that we're starting in Dresden and that really inspired many groups. So I want to introduce the method of Miyawaki, which is called Tiny Forest Method. And they have forests between 30 and 100 square meters, and they can keep a lot of water, they keep a lot of heat. So they are helping the heat islands. And what we realized is that if we talk to public sector, talk to the private sector and say, what are you doing about climate change? Have you heard about the method? They became very interested, and we really felt that many groups, they don't know what to do. They are just overwhelmed by feelings and they felt unhappy. So we went to the church, we went to the university, and we really met these people, said, do you want to have a tiny forest in your garden? There's just stones, they're keeping the heat. And most of them said, yes, we do. How do we do it? And I just wanted to introduce that method because maybe it's something for your communities.
Thank you very much. Really appreciate you. Dr. Jason Lee, Dr. Leah Werner, we could speak to you all morning, but we're not going to. Instead, we're going to thank you and ask you to take your seats back in the front row.
Thank you.
We really appreciate you. Thank you. So, a heat wave is an extended period of abnormal weather. It's interesting that in the UK, the extended period is about 3 days, which is like, whoa, heat wave. and the extended period in the United States with the National Weather Service is about 5 days. But we are seeing, regardless of how you measure your heat wave, more and more heat waves around the world. So how does extreme heat impact communities is what we're going to be talking about next with, I know you're going to be surprised, except you probably saw the flyer, so you thought, what is Pastor Neil Bernard talking about heat and health for? We will find out. Hello, Pastor. Good morning. Please take a seat. And Dr. Ashley Ward, welcome.
Thank you.
Pastor, tell us about your congregation, not how they're doing, but where it is.
Yes, so I live in South Louisiana, right outside of the great city of New Orleans, Louisiana. And we're experiencing the reality that extreme heat is beginning to affect our areas in a real way. One of the things that I just want to share, in 2021, we had a hurricane called Hurricane Ida that devastated our area and caused us to lose power for about 2.5 weeks. And more people died from the heat than from the hurricane itself. And that was a wake-up call for us because in my role, I do disaster response in addition to my role as a pastor. We realized that it's a necessity and it's a life and death issue that we must now begin to address extreme heat when it comes to disaster recovery.
I don't know if you recognize the pastor from the video we showed right at the beginning of our session, but you will also recognize Dr. Ashley Ward from that video where we were talking about communities coming up with solutions for extreme heat. So, Dr. Ashley Ward, what do you do exactly?
Well, that's such a good question. I really don't know. No, I'm just kidding. I direct the Heat Policy Innovation Hub at Duke University's Nicholas Institute for Energy, Environment, and Sustainability. And a lot of what we do is try and bridge the gap between communities, policymakers, decision makers, industry leaders. My thinking is that heat is no one institution's problem, right? It's all institutions' problem. And it's slowly eroding our physical, but social and economic well-being. And so we work to bring together people from across multiple different sectors, including faith-based organizations, and come up with what are the solutions, learn from one another. And this is how, I met Reverend Bernard.
Mm-hmm. Do you remember the first time you met him?
Oh, everybody loves this story. So first I should say I had read about him and the work of community lighthouses long before I met him, a tiny little snippet in some little newsletter that talked about the community lighthouse idea. And I've spent my career working in rural communities and really thinking about the impact of heat on rural communities. I thought, this is a fantastic idea. And I went to some of my partners and said, look at this idea. You have to read about this idea. This could really work in a rural setting. And so I was invited to the White House a couple of years ago for their heat summit. And as I was standing outside, waiting in line, in the heat, I should say, everybody was introducing themselves. And Pastor Bernard said, I'm Neil Bernard and it was like meeting a celebrity. And I think he thought, who is this strange woman who knows more about my life? I was like, I've read all about your work. It's so exciting, and we want to replicate it in North Carolina. And for, whether he wanted to or not, I stuck right by him the whole day.
Community lighthouses, your community lighthouse. Can you unpack it? Tell us what it is, what you do, how it works.
Certainly. So first of all, Community Lighthouse is a network of faith-based and other agencies that developed idea of putting solar panels with battery backup on key facilities like church buildings, medical clinics, and others that could be resiliency hubs in times of power outages. Because in South Louisiana, we live in a culture where hurricanes and storms are reality. And so it requires us to always be prepared. And but as I was saying, now we're not we must not only prepare for hurricanes, but now we must prepare for the fact that when we lose electricity, how do we keep people safe from extreme heat? And so the community lighthouse concept came out as a result of that through a group called Together New Orleans and some generous donors. They were able to fund the community lighthouse, and I currently have the largest community lighthouse in the state of Louisiana, and it's a proven fact because when Hurricane Francine hit our area in 2024, and we lost power, we were able to be a cooling center. We will be able to be a place where people can recharge their medical devices as well as a wellness hub. And so it's not just theory, it's working and it's saving lives.
Look at the pastor's face. Look at that smile. It's like, if you want to know what a success case looks like, it looks like the pastor right here. All right, so Dr. Ward, as you're doing your research, you're studying into the impact of extreme heat on communities. What have you found that you'd like to share with us?
So part of our work is helping broaden the conversation around heat. Health is so dependent upon overall well-being. And so one of the projects we do is we're quantifying the impact of heat across 6 economic sectors. And it's easy to remember because it spells the word health: housing, energy, agriculture, labor, transportation, infrastructure, and health. And so earlier the question was, how do you talk to policymakers and leadership and get them on board? Well, this has been very successful for us in how we do this. But I also think this is part of what this looks like implemented at the community level, right? It's not just about, one thing I think is important is a simple thunderstorm in the Southeast can knock out power, and particularly in rural communities, for multiple days. You take something that is a nuisance event and it turns into something that's dangerous. But community lighthouses become centers, epicenters in the community for all kinds of things. There's so many other programs that the community lighthouses also feature, which address those other things I was just talking about across all those sectors of the economy. And so this is what I mean when I say we have to broaden this conversation and create a pathway for people at the table who maybe don't work in health. Maybe they're concerned about energy transmission or even transportation or any parts of this, all of which, by the way, affect our community's health and well-being. And so what we're trying to do with the community lighthouse model is, I think scaling doesn't mean duplicating. It means adapting to a different context. And so that's part of what we're trying to do, take the lessons learned out of the model in New Orleans, what Reverend Bernard has been doing. How can we create this structure that then can be implemented in a different context, and in this case, in rural North Carolina?
Pastor, where else could this model work? It's not a model, it's actually happening. Where else in the world do you think it could work?
Well, again, I believe it can work anywhere in the world. I believe it can work in Asia, Africa, and even Europe, because it's not only scalable, it's affordable, but thankfully the technology is constantly improving all the time. So I believe this concept can work anywhere in the world.
Some of the challenges are finance, resources, but also leadership. So when you're scaling up or you're saying, okay, how do we do this on a policy level? But you've got sort of like a hotline to God, right? So that kind of overrides everything.
That's right.
There's a trust.
Just call them up on the phone.
So, one of the things we've learned, I can tell you in South Louisiana, is the power of collaboration. I'm grateful that we've been able to work together with local leaders, emergency workers, healthcare workers. We brought a team together because I've been also the chairman of a group called St. John Parish Long-Term Recovery. We learned the power of collaboration if we're going to help communities rebuild after disasters. And so learning to work together with those different entities have really helped us to succeed and help our community.
I think you asked me one time, what is one of the biggest lessons I've learned from working with Pastor Bernard, right? And I definitely think one of them, and if you listen to what he's saying, right, is if you approach one another from an adversarial position, it makes it very hard to bring additional people to the table, and it makes it hard to get things done. But, I think it's been very good for me to hear and learn about how we can actually communicate with each other when we have different incentives, when we perhaps have different views about, the role of government in society. But we cannot do this alone. It is going to take people, the whole of society approach, as the former panelist talked about. And you can't do that when you approach each other from an adversarial position.
Dr. Ward, one of the things that I'm really appreciating hearing is that communicating with the public doesn't necessarily mean you have to do it in a scientific way. I know that you truly believe that as well. So you're not necessarily going through rural communities talking to them about climate change. What are you talking to them about?
This is such an important point. You hear this statistic quoted from science that shows that in the US, labor productivity losses from heat are $200 billion a year. And that certainly sounds big, but honestly, to most people, that's completely meaningless. I mean, what we're really talking about is lost paychecks, lost wages. What we're talking about is people making the choice between running their air conditioner and buying food or medicine. It was one of the most unjust things when I worked at NOAA and working with communities is to hear this from people about how they're carefully rationing when they're going to turn their air conditioner on when it's almost 100 degrees. And we would talk with workers who would come home, and because they had no air conditioning inside and they lived in mobile homes, they would sit outside as long as possible to keep from going inside where they would just have to sleep And so you hear about how this is affecting the everyday lives of people. And this is where you start because that's where it matters to them. And so we start talking about what is going on in their lives. And I also want to say that this translates. The reason why the Community Lighthouse model is so powerful, in my opinion, is because we can think of all of these resources that we want to create in a community, and it sounds really great. But human behavior is complicated, and people are going to go where they're already receiving services, where there's a trusted community anchor where they can go and they received. It's not just about the cooling centers. I mean, we were talking yesterday about the summer camps and the housing and all of the other programs that come out of the Community Lighthouse. It's truly a beacon, right? It's a play on words, and it's true. And so I think it's just a wonderful model to think about. When we say, we're going to open this cooling center in this public library. Well, if you're not a family that goes to the public library, you may not know where it is. You're going to take your kids and everybody and your dog and go to the public library for a few hours where you don't have your stuff. I mean, but people go to their church. People go to these faith-based institutions who are already providing things, and they trust them because in other times of need, they are also there for them.
Pastor Bernard, I know you know your congregation, your community, probably on a first-name basis. Tell us one story from the Community Lighthouse that we will remember weeks from now.
Well, I guess, first of all, I want to tell you, in Louisiana, we have the best food in all the world. It's a land of gumbo and jambalaya, and so if you've never tried it, but what people remember, whenever there's a crisis, people are looking for solutions. They're looking for where they can go and get help. And I believe that because over the last 20 years since Hurricane Katrina, we have been doing that. We've been boots on the ground. We've been serving people in vulnerable communities, feeding the hungry, rebuilding homes, assisting them when they were in their greatest need. I tell you, we've established a reputation. So now, just as she said, when people find themselves without power, they're looking for solutions, and gratefully, we've been able to be that lighthouse in a darkening world.
It's obvious that you've got a warm partnership and it's working. What do you cherish the most about this science faith-based partnership that you have? Dr. Ward, you start.
So I think one thing that I really appreciate about this work is it is where evidence and empathy meet. It is, science and compassion, right? And also, and I think this is powerful. It is extremely powerful. Both data and science and compassion are equally powerful tools. And so what's happening is this is not just some imaginary benefit that's happening in the community. They're measured benefits. I mean, there's a method here, you know, and so it's a method that metrics can be set against. They can measure how many people attend, what the impact is in their community, you know, so on and so on and so forth. So it's a real thing, right? It's a combination of what we need of evidence and empathy. And I think that's probably one of the most valuable things that I take away from this partnership is, as much as I love research and science, and I do, I'm not sure that it really has the impact that we desire without also the empathy.
Yes, and so just as you said, I believe it's not either or, it's both and. We bring together, you know, we say it this way, we're better together, and together, you know, everybody wins. And so we've learned the power. I believe that the research community and the academia, they bring the information, they bring policy, they bring the research, but we need the boots on the ground to bring and those who connected to community. It's together that we're able to come up with the best solutions. And I believe that's the answer, not just in Louisiana, but I believe all over the world.
Let me just open up the conversation. I left some questions still hanging here, but thoughts and feedback for the pastor, for Dr. Ward, about what they're doing, anything similar that you might be doing, that you might like to start. Just let me see where the thoughts may well be. Or you're just so impressed, you're just drinking it all in. Yes, let me just come back to you. The microphone is coming to you. I don't even need to.
Oh, thanks so much. I had my hands up for the first speakers, but I think the question is also coming to them. I mean, heat and extreme heat are there for years, and people live with it since a long time ago. And we always find solutions naturally. That's why we speak about acclimatization and all this. I understand also a physiological limit. But as you're working through the community and trying to empower the grassroots solutions, I would like to know if there is any window for indigenous knowledge, how we can improve it, how we can learn from that. Thanks.
So that's an excellent question, right? And I think part of what we are talking about is community knowledge, and that includes indigenous knowledge. I mean, in different communities, you know, that we've worked in across both the U.S. and in other parts of the world, there are practices that are traditional practices that are already meant to deal with the issue of heat. And so where we can learn from those, we do and we should. I think one thing that is really a practical example is sort of traditional ways of developing settlements for humans actually captured wind flow, so that you know, you could use the benefit of wind flow. Some of the issues that we were talking about earlier, when it's hot and you sweat and it needs to evaporate, if it's too humid, for example, for that sweat to go anywhere, wind can actually mimic that evapotranspiration. And so with the advent of air conditioning and HVAC systems that have sealed all of our buildings, we stopped thinking in these ways and these traditional ways that we design communities. And so that's just a very practical example of ways that we need to get back to. And you see a few examples in the world of communities trying to actually, you know, capture wind, redesigning some of their corridors so you get wind corridors in different places to cool down and offset the urban heat island effect. I work mostly in rural communities in North Carolina, and in fact, many parts of the South in the U.S., rural heat-related illness rates are many times higher than urban heat-related illness rates. And so there's a lot of models there with respect to how communities do outreach with one another that have long been in place in communities. But one of the best is the storytelling and music that comes out of indigenous communities. We work with the Coharie tribe in North Carolina, and they actually have stories and songs that they sing to one another, to tell one another, and raise awareness of the impact of, not, in this case, not just heat, but climate in general, about environmental impact. So I think we have a lot to learn from communities about how we communicate risk and also how we structure the communities themselves physically.
Anything to add, Pastor?
No, I think she did a great job.
See, that's collaboration right there. Estelle, can you take the microphone to Ethel? She's in the front row. Only because when you mentioned, sir, indigenous communities, Ethel went like this.
Yes.
Right. And I'm sure there is something in there waiting to come out for us. Go ahead, Ethel.
Okay. It's because the example in Brazil, that indigenous population was responsible for the COP30 in Brazil. They press the government to be this because the area most affected is the Amazonia region, where the most indigenous population lives in Brazil. And the reason that the COP30 will be in Belém, in Amazonia, is because of them. And they raise their voice international, because not national. They come outside for inside. And they did a very important job. And I think this is the base that we are trying to build in the Belém action plan for health that I have chance to talk a little bit later.
It's a little preview of the conversation to come in a moment. Yeah. Ethel, hand the microphone to Chris, actually, because when you were nodding vigorously, Chris was nodding almost as vigorously about indigenous knowledge and extreme heat. Chris?
Yeah, I mean, it's really easy when you're working on the global level to... I really appreciate the way the session is running with the community approaches that we've heard about, and very local examples. And I think the indigenous and the local knowledge, and I will go further into this, back to kind of what Jason was saying, we know what we need to do. And I think sometimes it's a distraction, or even a sort of get out of jail card to not take action when you say, look, we need innovation, we need to do something differently, we need to do more evidence gathering. And I think we need to listen. Thank you.
Thanks. Please give the microphone back to Estelle. What's the most important thing that either you're about to say or you said on the stage, Pastor, this morning?
Well, again, I believe there's faith-based communities all over the world. I believe we're the greatest network in the world. And I believe that when corporations and business work together and collaborate and empower them to serve their communities where they live, then we can bring about real solutions and really save lives.
You make me want to come to your service.
Well, you'll have to come.
I really want to come. Dr. Ward, the most important thing that you're going to say today is what?
I think the issue of extreme heat is a real test for us as a society, and how we govern and treat one another with compassion. And most of the problems that are the solutions, I should say, most of the solutions, as Dr. Lee was talking about earlier, we have them, right? We need investment, right? But most of the solutions for extreme heat solve for other problems also. So if we can, heat has been called the silent killer, right? So if we can govern and relate to one another with compassion, and we can actually solve this issue of the silent killer, we can do almost anything, right?
Something that's going to stay with me is that concept, which I see with both of you, evidence and empathy. So thank you, Evidence and Empathy, for being on the stage. We appreciate you.
Thank you.
Thank you so much.
Please take a seat. All right, so we had basically a live trailer for Chris Carter and Ethel Maciel, because they're so invested in this conversation, they had things to say even before I invited them onto the stage. Ethel Maciel, Chris Carter, nice to see you. So I've taken you on a journey. We started personal, with the personal impact on our biology of extreme heat. We've talked about the impact of extreme heat on communities, and now we're going right to the top to talk about the impact of extreme heat when it comes to global policies. Ethel, so timely to have you here. So amazing that you've made the time. Will you tell everybody what your official title is, please?
So right now I'm the special envoy for COP30 for health sector. So basically what I'm doing is like a diplomacy in health and climate. And I'm going to one place to another talking about this, highlight the importance of have some guidelines, protocols, and the importance that we arrive in the COP30 with agreement, with a plan of actions that right now it's the high priority for the world, because we know that we are very interconnected, but in the day life, we live our own lives. We didn't realize that if I, for example, buy some ring, with gold ring, this gold come from probably American or Africa country, in a miner, that there are people there. So in our day life, we didn't realize how these are connected. Or if you are drinking coffee, they are growing someplace in not a very good condition that people are working there. So in our day life, we didn't realize how this can be in an individual act and in a collective act.
Very nice. Chris, when you're out socializing or you're at a convention and people say, hello, Chris, what do you do? What do you tell them?
That's not always easy. So I'm the Deputy Director for Human Development, the focus on health, at the UK's Foreign, Commonwealth and Development Offices. So
do they still stay and talk to you after you say that?
Yeah, I normally, they've moved on by now. Yeah, that's true. But in practical terms, it means I head up teams that cover our work and our programs on wash, water sanitation, nutrition, health systems, climate change impacts on health, and a big area for us, sexual reproductive health and rights. And of course, climate change has an impact on all of that work.
If we're looking ahead to COP30, I know you're both, of course, very invested in COP30, but I'll start with Ethel first of all. There are thematic days, 6 major thematic days, but there's also going to be a day, November the 13th, so not that far away, that is going to be dedicated to health and climate at Belém. What's going to be happening that day? Because we're looking at health and climate then globally. What should we know?
So we are preparing for almost a year right now, this Belém Action Plan, and with a lot of work in collaboration all over the world, including the Rockefeller Foundation, to building this action plan. Because right now, we all, in the others copy, what we have, it's like a declaration of intention. We are together, and we think that it's good to have like a health day, and the health is very important, but you don't have like actions. What is the actions? What indicator we are as a country, as the United World, what we committed with this? So what we are planning to have in Belém, and right now we have a pre-COP event in Brasilia, just happened this week, to try to make more alignments with this action in all of the areas, not only health, but to arrive in November with more agreement with this action. Right now, we have 3 like high-level actions. We are planning in the surveillance. We need more surveillance, more data. So how do we integrate this, climate and health? The second action is capacity building, infrastructure, because we need that health sector goes to this part. And the third action will be innovation and technology, because the health sector has a huge impact for the climate change too. So we have these 3 big actions with some indicators and for what we need to do. And if I may have an example, a very brief history, as one of the things that I did in this month, I go to a Petrobras, is an oil industry, very biggest in the world, and how to convince them that in the heat waves, the work needs to stop in the platform of oil, and how the health sector can interfere in this, because we are talking about millions, billions of dollars if they stop for 4 hours, 5 hours, 10 hours. So what they respond to me, we need to have something to guide us. We need to have some regulations, some law, because we cannot go to, because right now, there is no owner anymore. We have like a holding in some place with a lot of people that are owner this big company all over the world. So we cannot talk to Chris in face-to-face to say, you need to release your workers because there's no one owner anymore. It's very complicated, this big company. So we need to have some plan, some action plan that we agree between us and to guide the countries to implementation.
I'm going to come back to that action question because I hear so much discussion in climate and health about talking about what we're going to do and what we need to do. And I don't see what you're saying, Ethel, that we need is action, particularly coming out of COPs. Chris, you've just come out of the Wilson Park meeting. So financiers getting together, international leaders getting together, talking about how do we make health and climate work, or how do we make health work better, bearing in mind our climate realities. What were your takeaways? What can you bring to us?
Yeah, so just for those that don't know, Wilton Park, it's basically a country house that we can bring experts to for 2.5 days. It's a very beautiful spot, but it means you can have the intensity of discussion and all the discussions that happen in the margins as well. And we were trying to bring together health experts with private sector actors and climate finance experts. First of all, congratulations to Brazil on the Belém action plan. None of us want an action plan though that's not actioned. So Wilton Park was very much to talk about what are the barriers? How do we action this? First thing to say is that we need a fundamental rethink. And that's a theme of this summit. And it's really relevant to this space. I totally agree that it's going to be bottom up and community level. And that comment around people have to have a stake in it and own it for change to happen. But it does matter what governments do, what local governments do, what your district authorities are doing so that it doesn't get in the way. It should be supporting. So just 3 conclusions. There was a lot of discussion, you can imagine. Some of these things are really familiar, and we know, and some are a little bit newer. The first one, I'm just going to start with it. I really think it's fundamental is data. It's back to data and evidence. And we were all very worried about going dark because of the financing crisis. A lot of the data has been financed by the US. And we talked a lot about how you make data relevant to delivery and decision making, and the new forms of data, the forecasting, the projections, climate services. The other thing we discussed quite a lot, you'll be pleased to know, is how we cost these actions. Where's the money going to come from? And I would say we all recognize that to do that, we have to get out of our silos. Again, that's come up a few times already. And I realize working in this role across all these different sectors is that when we're talking about it, we really mean our mental silos, our narrow expertise. See, I have a lot of people who are experts on nutrition, or experts on health systems, or in sexual reproductive health and rights, but they don't know enough about each other's work sectors. And we found that with finance as well. So our health finance experts don't really understand climate finance, and likewise. And then there's the private sector finance as well. Just on the private sector, it was great to hear from them. I mean, obviously it's multifaceted, right? When we talk about the private sector, it's a given. But there are certain things that really came out strongly. One, it has to be about revenue generation. Has to be. And we talked a lot about, for that to work, you have to have specific proposals. So if you're talking about public-private partnerships, it has to be specific. And then we talked about quality of life, which again has come up. That matters, but some of the health arguments that we've been using don't matter. They don't work. Then, of course, it's not...
Share us some, so that we don't go and use these health arguments that don't work. Give us a health argument that is not going to work at a high level.
We talk a lot about universal health coverage. We talk a lot about, inclusivity. It's jargon to some extent for some of the private sector.
So it's jargon for the private sector. Is it useful for the federal sector, the government level?
Absolutely. I'm not saying ditch it. I'm just saying use the right language for the right groups of people.
What does the private sector want to hear? You're going to make a lot of money from doing this. I'm not even being cynical here.
Yeah.
Actually, no, I am. I am being cynical. What's the language of the private sector? Success, money, return.
It's not a lot of money. It's revenue generation. I was very careful not to say just profit, because the private sector's, doing lots of different things. But there's a model where they're getting returns, and enough returns. They do work at the community level. You're talking about really smart investments on infrastructure. So, for example, we talked about solar panels. In very poor countries, solar panels can give back to the grid as a generation, or do other things, right? And I'm sure that's in that example. Disaster risk investment can be reimagined so that it works. That could go on. But, I mean, Ethel, you maybe want...
Can I jump on this conversation? Because I think one of the most new proposal that the COP30 are working with the financial sides, not health itself, but it's a financial. It's, I don't know if you heard about, it's like it's a trust, it's a tropical, I'm trying to put in English, a tropical forest fund forever is the name of the trust. And this will monetize for people that live like indigenous population, traditional communities that live in this area with forest, that the whole world depend of this, but in their day life, they didn't have incentive to not devastate, to plant something, coffee or tobacco or whatever gives money. So this trust will be monetized, it will be like a investment. And right now, the proposal comes from Brazil, Colombia, Ghana, Indonesia, Malaysia, some other countries. And with support of some investors as Germany, France, UK, and Emirates. I think it was the beginning of this conversation. And they are building this 2 years, and this will be launched in the COP30. And they already have some money, and in this week they are trying to put this in place. So I think this will be like a game change, because we have some money for this community. Because as we talking about in the previous conversation here, in some countries, people can choose between food and air conditioner. But other countries, as Brazil, as Congo, as Indonesia, people can even choose between these two of this, because they don't have how to choose this. So for countries that don't have welfare state, it's almost the global south, we need to have some incentive. We need to pay for this. Because here in Europe, we are breathing the air by our forest. So we need to pay for this. This is an investment. So this is a very complicated conversation. It's not an easy conversation, as you are saying. You are not be like ironic, but it's the conversation that we need to make, because we are in the interconnected world, but very unbalanced with all this history of exploration.
So this plenary promises stories and solutions. Ethel, Chris, you're giving us stories, now looking for some solutions from the global policy level. Chris, what do you have for us?
All right, I'm going to give you some big wins. And we did touch on this. Fossil fuel subsidies. Right, it's really difficult to remove subsidies, but there are ways of doing it. That could raise $1.5 trillion to $7 trillion. Fossil fuel subsidies. Big elephant in the room is debt. Many countries are in a debt crisis, but we know how to restructure debt, moving from expensive loans to concessional loans. And I would just throw in health taxes. And I was just in a session where I heard a partner government say, look, we don't have universal health coverage in this country, and yet we have some of the cheapest alcohol, cheapest tobacco, right?
Yeah, health taxes, low-hanging fruit. Tobacco, alcohol, sugary drinks, instant revenue. Ethel, global level solution. I'm not even going to ask you for plural, but a good, impressive one.
Yeah, there is a discussion about the billionaire taxation, and this is a conversation around COP30 and G20, and there is an initiative in G20 to make this happen, and because the way that the money goes to one country to another, it's very complicated right now to follow this. And just an example, with this new modification in the US government and this taxation for the country, we have a specific day that Brazil was taxing in 40%, and but someone knows this new before this was announced. And this was under investigation right now in Brazil because someone outside make a lot of money investing in this tax for the real, our money, and dollars, sell and buy in less than an hour. So this is under investigation because it's a crime and so on. But this is the way the world it is. It's not the most important or the biggest money are not to produce things. It's to make all this complication in the financial market and so on. So this billionaire taxation is a conversation because this can help to make the adaptation for the countries and help especially the health sector.
Chris, in the work that you do, the theme of our World Health Summit is taking responsibility for health in a fragmenting world. When you saw that and the work that you do, how would you unpack that idea? Give us an example.
Yeah, I mean, the UK is one of the largest donors to the Global Fund, to Gavi, to IDA, World Bank, to WHO. We're part of it, right? But we recognize, and we have been at the forefront of wanting it to change and reform. And it is reforming. It's been, I don't know how many of you have been at the sessions on the global hub architecture. I've really heard a difference from people like Sanya Gavi and Peter Sands from Global Fund in the way that they're talking about this. That's a big change. The other part of this, of course, is declining odor. And again, UK is part of that. We are cutting our odor. I will not connect reform to declining. It's not an excuse. There's no fig leaf for cutting odor. But I would say, absolutely, and this was a conversation back to Wilton Park, it's not just about finance. It's never just been about odor. So we did talk a lot about expertise and know-how and technology as well. And for me, I would be crazy by now because I go to conversations on the financing gap on child wasting, 45 million children are wasting, on water and sanitation, on sexual reproductive health, or on commodities. What we need to do, back to the fragmentation, is to recognize this is all the same endeavor on primary healthcare, and integrated primary healthcare. If we can bring all that money together behind that, we would have the leap forward that we've been talking about.
Sure. I want to get a little bit personal and get closer to the heat and health question. November 23rd, 2023, excuse me, November 2023, extreme heat wave in Brazil made global headlines. Where were you, Ethel?
I'm the Minister of Health responsible for this emergency. And was a very tough moment in Brazil, as we are discussing in another roundtable with Jason. We used to, in the tropical country, we used to be very comfortable with heat because we are tropical, we are always summer, so we have music about this, so it's very cool. We are always summer. Sometimes rain, and sometimes don't have rain. Not rain, but always summer. And this is the way that the community, the population lives. It's normal, it's natural. And but 2023, there is a turning point, and we have some floods, very important, in the south of Brazil. We have wildfire in the Pantanal, very important biome for the world. And we have the worst dengue epidemic ever. And Brazil people came like, wake up with this dream of summer, saying that this heat is different. So now, with this opportunity of COP30 in Brazil, we have this very good scenario to discuss of this, to put the climate in the agenda, but it's very new in Brazil, this conversation.
We have 7 minutes left in this plenary session. If you've been sitting on a question, you've got a thought, some feedback that you would like to share with us, right here in the front row, now is the time to put your hand up.
Thank you so much. Thank you so much for the opportunity. My name is Anin. I'm from Indonesia. I'm delegate of International Federation of Medical Student Association. So my questions, it's about in many low and middle income countries, we have this heat and health problem, which is occurs in like outdoor workers, urban poor living, and this group of people often remain invisible in the policy-making decisions. So my question is like, how can the governments and global health institutions ensure that this group of people are can be applied to the health, climate health adaptation strategies truly to center this vulnerable population rather than applying one size fits all? So that's it. Thank you so much.
I don't have the question. It's like we are not saying 1 million anymore. It's like billion or trillion. So we have the same question. We are building together, your country, our country, the country that more suffer with this. This funding, we need to come out with some criteria who will assess this funding, who will be, which country can be for which policy. So this is what we are discussing right now to come out in November with one common solution. We don't have yet. We have the Paris Agreement with 10 years right now with Paris Agreement, but we saw that this was very beautiful in the paper, but we lack to implementation this. So we are very good in words, but not very good in putting practice. So I think this is, for the first time, I think, the Global South has the power to say what is important for us. And I think we need to say, we need to take this opportunity to take in the state and say, oh, I don't agree with this. And if you take this, we need that. Because we never do this negotiation. The negotiation is always very hierarchical, and we, in the South Global, only always in the bad situation to do any negotiation. So right now, we have the forest, you have ocean, you have water. So this is a common good for the world, and we need to take this opportunity to make good negotiation with this. So I think this is our opportunity, and we are very ambitious with COP30 because of that.
Thank you, Ethel. The final question.
Oh, I have the privilege of doing the final question. Dennis Susan, thank you very much for this very interesting panel. I want to take the chance to shine the light on the effects of heat on women and pregnant people. So thank you very much for mentioning pregnant people. They are often forgotten as a group of people, especially at risk by heat. And I was wondering, so maybe as a quick anecdote, so I was doing research on the effects of heat on pregnancy. Here in Hamburg, here in Germany, in Hamburg, a German city. And we do an original study and also doing a review how heat is affecting pregnant people. And it struck me really that there's a severe lack of knowledge. So you talked about the effects of heat, but it's totally different in pregnant people than normal people. So in order to write this review, we needed to assess the only publications that were available, and those were publications on cattle and livestock. Right? Because there's an industry behind that's really interested in the offspring of cattle and so on, which is scandalous in my opinion. So my question is now, since heat stress is nothing new, well, it's getting worse, but it's nothing new. Pregnancy is definitely nothing new, and don't get me started on menopause and things like this. So how do we address this knowledge, this gap of knowledge, and to fill those gaps? Thank you very much. Maybe more a question for you.
I'm going to take it. Oh, the front row has knowledge. Thank you.
So your point is very well taken. I could not believe when we were working earlier in the Southeast, we published the first paper ever published on the impacts of heat on preterm birth in the Southeast. That was 2019. Now, I don't think that's something extraordinary we did. I cannot believe that it was not done before. But to your point, we had to turn to, there was not a lot of evidence, not a lot of thing to pull from the literature on this. But one of the most important things that we found is that actually overnight temperatures had by far a greater impact on preterm birth than even heat index maximum temperatures across 7 different heat exposure metrics, lags, accumulative exposure, so on and so forth. And, rural, in the North Carolina context, rural women in rural communities were more at risk than women in urban communities. We've seen that work replicated in other places in the Southeast that have similar results. But to your point, that was born directly out of community engagement. We kept hearing people in communities say, we would say, who is most vulnerable in the community? And people would say, pregnant women. And finally, I was like, we should probably look into this thing with pregnant women. Everybody keeps talking about it. And I was really shocked at the lack of research on this specific topic. So I personally really thank you for bringing that up.
I'm going to be brief so that you can have something to say, but pregnancy, there's ethical reasons that the research community says we're not going to do studies on pregnant people. It makes it very, very challenging. It also puts pregnant people in this very strange, dangerous niche in medical practice. You know that blood volume increases by 50% in the third trimester. When we study the Starling curve, which is the pressure within the vascular system, the curve changes in pregnancy. We have increased minute ventilation within the lungs. So the way that people are even processing the oxygenation down to the mitochondrial level changes and is different. And the increased pressure on end organs within the body with heat is even greater during pregnancy. One of the solutions, and I heard this at Aspen Ideas Climate in Chicago, is quantum computing, which basically states they can do head-to-head clinical trials without human beings. They can replicate physiology. And I immediately thought about pregnancy. We have these ethical implications about doing research on pregnant people for obvious reasons, but the University of Chicago Institute of Quantum Computing is apparently going to study this for us. So that remains to be seen, but I'm going to be watching, and maybe you can too.
Got it. I just want to add, climate change will only exacerbate inequality. But therefore, there lies an opportunity when a lot of vulnerabilities are finally being exposed. You can choose to build then a new home. You can choose to do the patches on the roof. Whatever resources you have. And I just want to, great discussion, but I just want to inspire that this is the time where a lot of vulnerabilities are being exposed with a new stressor called extreme heat. And therefore, this is an opportunity for us to address the root causes of all these vulnerabilities. I was hugely inspired. Most vulnerable people, eventual hope is to seek for spiritual help. Maybe the churches, mosques, temples. Today I learned that is a wonderful platform to preach the gospel of heat health using these platforms. Yeah, so I want to inspire upon all that is great hope. Use that and do good accordingly. Yeah.
All right, Ethel and Chris, sorry to abandon you on stage. Please stand up. Jason, please come on stage. Leah, on stage. Ashley, please come on stage. Pastor Bernard, please come on stage. This plenary session was brought to you by the Rockefeller Foundation and these wonderful experts who are going to stand in a line so they look photogenic. Fantastic. We have, I hope, given you some idea and hope that it is possible to future-proof health systems by looking at the personal, by looking at community, and looking at global policy as well. To get more information, go to rockefellerfoundation.org and look up Future-Proof Health. My name is Femi Oke. I thank you for choosing to be in this space at this time, at this very busy World Health Summit. Have a great rest of your day. Online viewers, thank you for watching. Take care.